thank you for inviting me to this conference. It's a pleasure for me to share you the experience of our first breast unit in Palestine, which was supported by the Association of ALS and Campus Biomedica. Thank you very much. This is the first celebration in breast unit in 2018 when it was first established in October 2018. This was our first celebration in October, Breast Cancer Awareness Month. Let me have the opportunity on behalf of Beit Jala Governmental Hospital. I would like to present my gratitude and appreciation to Association Centro Ellis for its invaluable support and contribution to improve the infrastructure in Beit Jala Hospital in company with the Campus Biomedica. This is our first training in September 2018 when our colleagues from Campus Biomedica came to Palestine for training us. The input of ALICE project aimed to strengthen the Palestinian health system with the establishment of a multidisciplinary breast cancer unit. The achieving goals, creating a new approach in dealing with the breast cancer as a multidisciplinary approach at hospital level. It was the first breast cancer unit in the West Bank. The unit was equipped with the most modern, sophisticated machines as Italian one. The staff were well trained by Italian experts at national and Italian level. The unit was serving not only Bethlehem, but also all cases from the south, Hebron and the villages nearby. The unit became a model for the Palestinian and donors. For example, MAP UK established similar breast unit in the north, in Rafidia Hospital, Rafidia Governmental Hospital. This is a small photo of our breast unit in Bethlehem. It is a full service at one spot, provides full service for breast cancer disease detection by multidisciplinary team from imaging by radiologists with mammogram tomosynthesis reading result, ultrasound, and also biopsy. Here is a photo of the breast unit with the equipment. We have digital tomosynthesis with stereotactic biopsy, which was training on it was in 2018 for detection of early breast cancer for cluster of microcalcification. And here is the ultrasound room. Goals of the unit: provide most accurate, clear results and manage difficult cancer cases all at one spot. Save time, decrease X-ray exposure, reduce costs to the government, double check, fewer other tests, especially biopsy. And when we talk about reduced cost to the government, because we know that breast cancer treatment is very expensive. So when we diagnose cancer at early stage, the treatment cost will be low for the government. Referral from the unit are from the primary health care service. In all the West Bank, there are primary health care that have mammogram for screening of breast cancer from clinics in the hospital, in Beit Jala Hospital, and also from private clinics outside the hospital. Or contact with the case manager and put appointment for them, and then they came and have all the tests they need. This is another training on stereotactic biopsy in August 2018. Small statistics about the West Bank from our MOH. Breast cancer is the most common cancer among Palestinian women. It is the second commonest cause of death. It accounts for 32% of all cancer among female Palestinian women. Incidence rate 36 per 100,000 women in 2021. Last year, in 2022, there were 540 new breast cancer cases in the West Bank and 394 in Gaza. Now, of course, now these days, because of the war, we lost the data with Gaza. We don't know exactly about their statistics. Breast cancer in Palestine, what is the vision of our Ministry of Health? Of course, to make state of Palestine among countries with low cancer burden and incidence and mortality reduced, and of course, the survival and quality of life improved. This is our mission. Crude incidence and mortality rate in the West Bank since 2012 till 2021, we see that the incidence rate has changed dramatically since 2015 and above. There is an increase in the incidence rate in detection of breast cancer. That is because the entrance of the mammogram machines to all the primary health care in the West Bank. Also, most of them were supported by the Italian cooperation. They entered machines, mammogram machines, to the primary health care in the West Bank, and because of that, screening increased and detection of breast cancer increased. Of course, as my colleague mentioned before about the cancer care continuum, it is begins from the prevention, about our lifestyle, alcohol, smoking, risk factors, then screening by the mammogram, ultrasound, biopsy, early detection, diagnosis, also the treatment, then palliative care. All is one circle. This is the age group in the West Bank. From the MOH statistics, we see that most ages between 40 and 60 years, which is young population age. This is from the West Bank. And also we see from 2017 till 21, most of the cases were stage 3, locally advanced breast cancer. This is statistics from the West Bank. Now, our breast unit statistics that we did in the last 3 years, from 2021 till 2023, breast unit in Palestine, in Beit Jala, these are our local statistics. Total ultrasound around 2,241, core biopsy 451, proved cancer around 50% of the core biopsy that were taken proved to be cancer, about 229 breast cancer biopsy in the breast unit, not only from Bethlehem, also from the south. When we see the mammogram, total mammogram around 3,145, diagnostic only 724, but we see that the cancer proved from the diagnostic is much higher than the screening. The screening about 2,493, but the cancer from the screening detection only 17, and the cancer detection from the diagnostic mammogram 77. Total cancer in Bethlehem in these 3 years, from 2021 till 2023, 94 breast cancer. Bethlehem is a small city. It accounts for around 250,000 citizens. So we see that breast cancer, and we have a good amount of breast cancer in a small city. The age, we found that the age below 40 was 13%, from 40 to 50, 32%, from 50 to 60, 25%. We see that most of the breast cancer women are from 40 to 50, and before 40, only 13%. Universally, below 40 is 5%. In our data, it is 13% below 40. And the median age in the United States and universally around 62. Our median age in Bethlehem in this study is 52. That means that breast cancer begins 10 years younger than the European ones. Family history, of course, family history, only 15% worldwide have family history before getting breast cancer. Here in our study, only, 20% had family history and 70% with no family history. So it seems like the worldwide statistics. This stage was because of the breast unit. We see in the beginning of the slides, in the West Bank, not only in Bethlehem, most of the stage was 3. In Bethlehem, when I did this statistics for these 94 case breast cancer, stage 1 and stage 2 account for more the percentage, 40% for stage 1, stage 2, 24%, because there is a unit that the people can come and they can find confidence, and we can do for them everything at one visit, mammogram, ultrasound, biopsy. So they save time and several trips to decide where to go. Stage 3, 24%, stage 4, only 11%. So we see stage 1 and 2 accounts for highest percentage, represent 64% of our study. Stage 3, only 24, and stage 4 represents 11%. And we all know that stage is connected for 5-year relative survival rate. If we find cancer stage 1 and 2, the 5-year survival rate is high as much as 99%. So it is very important for the survival rate in the future. The hormonal receptors in our study were as much as worldwide, no difference. ER positive 72%, HER2 positive 23%. These hormonal receptors are important for the treatment, the same as worldwide, these receptors, no changes. As we see that the number of diagnosed breast cancer in a small city is serious, the patient saves time and several trips to decide where to go, as I said, and encourage also other patients to come because they will feel comfort that they will find everything they need in one place. I would like to talk about myself a little bit, about the influence of this breast unit for me. I opened my new clinic 4 months ago. My dream came true by opening my own private clinic that I worked hard to let it at very high level. This was the first private breast clinic in Bethlehem to be directed by a female doctor. This is the logo of the clinic. It is Hope Breast Clinic, and the logo. This is the photo of the clinic inside. This is a video about my clinic. We do breast ultrasound, biopsy, and also we have oncology doctor. He comes once a week. We have also oncoplastic doctor, comes also once a week. A new and also a good machine, ultrasound. Okay. Also, it's my honor to tell you that I'm chairwoman of LANA Association for Supporting Breast Cancer Patients. I'm telling you this story because the woman who invested this association was one of our patients that I have detected her with early breast cancer. She came because of screening. She didn't have any symptoms. She came for screening and detected a very small breast cancer at early stage. It was 9 millimeter. And I did for her the biopsy. It was proved to be breast cancer. She has took all the treatment and she's very well. So during her treatment, she noticed the lack of psychology and psychosocial support. So she decided to invest or associate association for caring about the psychological support that women need during their treatment for breast cancer. This was her mammogram. On the CC view, we can't see anything. But on the MLO view, as you see, a very, very small cancer. It was the mass. On ultrasound, 9 millimeter, and biopsy, it was invasive ductal carcinoma. This is the logo of the LANA Association. In Arabic, it means that we will never give up. لن نستسلم أبداً, يعني we will never give up. It aims to offer the needed psychosocial support and guidance for women diagnosed with breast cancer and their families so they can better be prepared to face this fatal illness with the least suffering. Again, allow me, on behalf of my staff, my hospital, the Palestinian women, to thank you all for this impressive, generous contribution, and we will assure you the sustainability of this important, invaluable work. But at the end, we can't forget Gaza, that it is a part of our land. We are all one country. They have war, as you know, and they have also many breast cancer women that didn't take treatment, or not only breast cancer, also children have cancer, and also cancer also in men. But because I'm talking about breast cancer, I'm focusing about breast cancer. As we said, in 2022, around 329 women was diagnosed with breast cancer. This year in 23, I don't know exactly because no statistics. And so we hope, as I said, that the war can stop, and that also the ladies can, and also all body can take their treatment, because there is no treatment, no food, no electricity, nothing now because of the war. So we hope to find peace, and that the war will stop, and we will wake up from this nightmare. Thank you.